Hello, I'm Mitch Fox, President of the Nevada Broadcasters Association, and I'd like to welcome you to another edition of Nevada on the Air, a program that highlights the leaders and innovators and out-of-the-box thinkers who are shaking things up and making a big difference in communities throughout the state of Nevada. I'm extremely pleased to have United States Senator Jacky Rosen on the program today. I'd like to give you a proper introduction, but it'll probably take up our entire time, so I'll have to be a little bit brief. Before being elected to the United States Senate, Senator Rosen represented Nevada's 3rd Congressional District. She served on the House Armed Services Committee. She was able to secure a pay increase for our men and women in uniform. She served on the House Science, Space, and Technology Committee, where she passed legislation through the House to improve early childhood STEM education. You did all sorts of other things. You defended the constitutionality of
the Affordable Care Act.
The Affordable Care Act.
We got the Forever GI Bill passed. I'm really proud of that one. The President signed that into law, and lots of good things. Lots
of great things. And, you know, I happen to know, because I know people on Capitol Hill, that you were one of those people that really attempted to work on a bipartisan basis. And people are looking for that, right? You
Yes.
made that a capstone of your time.
Yes, I think people want someone who's practical, pragmatic, and has common sense. So I was part of that group called the Problem Solvers in the House. We're bringing it over to the Senate. And what we're equal amount of Democrats and Republicans committed to finding that space where we get along. We always make the big joke that everywhere in America has potholes. Everybody wants some potholes fixed. So there may be some issues we don't agree on. You see those on the news every day. But let's fix the potholes and fight about those. Let's not sacrifice the fixing. And so I think that's really important. And so that's how I approach all my work and all my committees. Wherever there's space to get along, where we agree on good, solid work for Nevadans, for kids, for our health care, veterans, whatever that is, I'm going to be on those bills. I'm going to agree where I can, and I'm going to argue where I must.
You know, your staff was so helpful, they gave me a list of your committee assignments.
We're busy.
So Senate Committee on Health, Education, Labor, and Pensions, and then you serve on 2 subcommittees there. Also the Senate Committee on Commerce, Science, and Transportation, 4 subcommittees in that overall committee. Senate Committee on Homeland Security and Government Affairs, 2 subcommittees there, plus a Senate Special Committee on Aging, Senate Committee on Small Business. So when did you come up for air?
Well, you know what? I do have a great team, and they help me prepare and get ready for all the hearings. And luckily, our committees, they balance the way we do things, and they work in coordination. So on the Help Committee, we're talking about pain management, community health centers, teaching health centers, increasing the number of residencies across the country. There's a physician shortage. Actually, there's a medical care shortage across this country in this entire healthcare spectrum, nurses, physical therapists, and the like. So our subcommittees have a lot of the hearings, bring that up to the full committee. So we're not doing every committee all at once. They're kind of working in tandem.
You know, I just thought of this because I just had a tour of Touro University.
Yes.
As you know,
Yes.
You know, residency programs, there is a need for that. People don't acknowledge that or perhaps even know that.
Last session, we were on a bill to increase graduate medical residencies by about 15,000 across the country to new medical schools, which we have one here in Las Vegas, and to underserved communities. And so you don't grow doctors overnight. They have to have those residencies. We wanted to expand them across the country. Unfortunately, it didn't pass last Congress. I'm looking to reintroduce that this time in the Senate through my Help Committee and see if we can expand that, particularly here in Nevada. We have a lot of underserved communities as well as a new medical school.
You know, right now in the news, everyone's talking about immigration. There was a government shutdown. There were so many hundreds of thousands of federal workers that were impacted by that. And the president has decided that it calls for a national emergency to fund this wall. What are folks in Congress thinking about this right now?
Well, the president even said so himself. He said, I didn't have to declare a national emergency. I just wanted to. I wanted to do it faster. So by his own words, he understands this isn't a national emergency. What to me is a national emergency is protecting people for being having health care for their pre-existing condition. What's a national emergency? Being sure that our kids K through 12 have a good, solid education to prepare them for the jobs of the future. So what I'd like the President to do is work with Congress on bipartisan immigration reform, one that does protect and secure our borders in smart ways and helps our country grow through immigration like it has been, that is the story of who we are as America, and addresses many other issues across this country that really are going to impact our future.
You talked about, many have talked about comprehensive immigration reform. Border security is a component of that.
Right.
How can Congress work to actually integrate a comprehensive plan into this wall issue? Is it possible?
Well, I hope so. I was very pleased that the people who came together to keep the government open this time, you saw that those members of the House and the Senate were able to sit down at the table and come to some agreements. And so what we need to do is figure out what we want to fix first. We have Dreamers, DACA kids. That's really important. Here in Nevada, we have those TPS recipients that have come from El Salvador, Honduras, other places around the world because of natural disasters and other things. So we want to see what the plans are to fix that. We also have asylum seekers. But then on the other hand, we do have a medical shortage. We have technology shortage. We have a lot of other things for people to come here and work, have a pathway to citizenship. It's really important. It's the narrative of who we are. It's what makes us great. It's a big melting pot. And I think we just have to work on it step by step.
The Department of Energy recently acknowledged that they shipped about a half-ton of weapons-grade plutonium to the state of Nevada, didn't tell anybody, didn't notify the state at all.
Right.
What did you feel when you found that out?
Well, you feel deceived. Number one, they should have been working with the governor. They should have been working with the Attorney General. They should have notified the federal delegation. And so this deceitful act, we went to stop an injunction. There was a lawsuit in South Carolina that they said they needed to move this weapons-grade plutonium to Nevada. We went to court in good faith. They came there. They had already shipped the plutonium to Nevada. So they went to court knowing that they were lying. That's what's wrong. So what they need to do is come to the table and let us know what they're going to do, if they're going to do anything. I'm pleased to say that the governor and attorney general have reintroduced a lawsuit to stop anything else from happening. We had a classified briefing, myself, Senator Cortez Masto, the Southern Nevada delegation. I can't reveal what we talked about in the briefing, but we'll be using every avenue we can to partner with the governor and what we can do on a federal level to stop any additional shipments from coming here.
You know, it was revealed, I think, during the last election that people are concerned about their health care, probably more than any other issue. You know, they don't get a lot of things that are going on Capitol Hill, but they understand we want our health care. And there's a lot of ideas floating out there, Medicare for all, or maybe lowering the age of Medicare. It is very difficult sometimes for seniors that aren't Medicare eligible to sometimes find health care. Have you seen some ideas out there that you could latch on to and say, yeah, we can move this forward?
Well, what I can tell you is this. What I found on the campaign trail is that no matter how young or old somebody was, no matter what ethnicity, what religion, no matter how much income they had, the biggest fear, the biggest anxiety that each and every person had was the removal of that protection for being able to get insurance for a pre-existing condition. Everyone is just one diagnosis away from a pre-existing condition. And if you don't have something already, you probably know somebody else who does. And so I was proud that in the House, I led that resolution to sign on to let the House of Representatives be party to that federal lawsuit to protect the constitutionality, that portion of the Affordable Care Act. That didn't pass the House last time. They reintroduced it in the 116th Congress. They passed it. I came on with Joe Manchin was the person who did that in the Senate. He was nice enough to let me sign on with him, so we reintroduced that in the Senate. I'm going to keep fighting for that. After that, the second thing people worry about is the cost of their prescription drugs. They're going up and up and up. Insulin, allergy medicine, not even just to mention any kind of medicine for chronic disease. If you have something like MS or Parkinson's where you may take medicine on a long-term basis, people are very fearful. So I've introduced some bills last time. in the House of Representatives to cap prescription drug costs. We're going to be doing that again in the Senate.
Along the same lines, the VA, you introduced bipartisan legislation to improve the VA, and there's a lot of concern about what's going on, particularly in hospitals across the country. Are veterans being served? Do you see any progress along those lines?
Well, I can tell you that I think veterans are our #1 priority. They have served our nation, not just the veterans themselves, but their family members alongside of them, and they deserve every bit of care that they can get. The really great thing about our VA, and what I hear from a lot of folks who work there, is that a lot of times the employees that work there were veterans themselves, so they're able to really reach out and understand what the veterans are going through. We give lots of veterans jobs, like I said, at the VA, and there's a real camaraderie there. And so having this special place where they can come and understand the needs of someone who's been in combat, PTSD, chronic pain, anxiety, and unfortunately, whatever kind of physical disability they may have suffered because of their service, we need to be sure that we take care of them in a kind, gentle, thoughtful way, make sure that they can live their life the most productively they can when they're back.
One last question, that is, as you know, the Nevada Broadcasters Association represents the entire state of Nevada, and now you do too.
I know, isn't that great?
It is great. And going through the state, not only during the campaign, but now since you've been elected, are there commonalities that you find? I know that some people say, well, rural's different than north and different than south. What are you seeing? What are you hearing?
You know, the funny thing is that people are the same everywhere, because when you ask people, I always ask everyone this famous question, what keeps you up at night? And people always say, I worry about my family. I want to be sure my kids do better than I do. I want to have a good job. I want to make sure mom and dad are okay, or I'm going to retire all right. And so at the heart of each person is worrying first about their family and their loved ones, what keeps us safe and healthy and happy, and then their community, their schools, their churches, their parks. So everybody's the same, and they all want the same things. And as much as we think we're different, that core love of our family and our friends is something that unites each and every one of us.
Senator Rosen, thank you so much for
Thank
joining
you.
us today, and we look forward to seeing you in Washington, D.C.
Thank you. Next week?
Yeah, we'll be there. Nevada Broadcasters Association going to Capitol Hill to represent all the broadcasters, radio and television in the state of Nevada. So we're all out of time. I'd like to thank you for joining us. Until next time, I'm Mitch Fox. Have a great day.